Hello everyone, it's Matthew McKenzie here, back again with another quick lecture. And this time we're going to look into the top tips on caring for someone with psychosis. Now, this is only coming from my own experience, my own lived experience as an unpaid carer when I was caring for my mum, and what I've heard from other carers who join and network with the care groups that I run across London. So let's get into this lecture. But before I do continue, I just want to make sure that you remember to hit the subscribe button because I've been running this YouTube channel for many years now. Must be 9, 10 years of stuff on here. So I don't want you to miss anything. And there's always lots of content on unpaid carers, mental health and health inequalities, anti-racism, awareness regarding events, particularly with health and mental health. So hit that subscribe button and look forward to other content. I'll put more information in the video description. So top 10 tips when it comes to caring for someone from psychosis. Obviously, caring for someone with psychosis, as we all know, can be challenging. No fault of their own. It's just the nature of the illness. But with the right strategies and the right focus and tips, you can provide effective support while maintaining your own well-being. And I stress that's quite important. We all have mental well-being, maybe physical well-being. And I think it's so important that we include families, friends, and carers in that well-being as well, because that's the point. You can't care for someone if your well-being is at risk. And to be honest, I did go through situations where I was stressed, anxious, depressed, angry, because I felt I didn't have tips when I was caring for someone with psychosis. So I'm just trying to lay on the line and say, listen, there are things that can help you, especially if you're new to that role of being an unpaid carer. So the first thing is basically learn about the condition. Learn as much as you can about psychosis as possible. As you can see the images at the bottom, we have someone visiting a community mental health team, a hospital, a care center. So if you understand that condition and there's leaflets being shown in those pictures, it helps that you educate yourselves about psychosis, about its symptoms. And with psychosis, it can come with delusions, it can come with hallucinations or disorganized thinking. Look at information, especially titled What You Need to Know About Psychosis. You can even go on websites, to be honest. Obviously, the ones that are well known, I'm talking about from charities like Mind or Mental Health Foundation, Rethink Mental Illness, Sane. We also got national carers charities like Carers UK, Carers Trust, especially something what Carers Trust have, which is the Triangle of Care, may have information that cascades down to NHS trusts that provide information about psychosis. And come back to this, look at the common cause. You know, what's causing it? Could it be a form of schizophrenia? Could it be bipolar disorder, severe depression? In the end, knowing more about the condition helps reduce fear and confusion, and it allows you to respond better to the person's needs. So you know what you're dealing with. I'm not saying you're going to be a university professor in understanding psychosis. Remember, we are unpaid carers. We're not trained to do the role. We just often fall into it. But it doesn't hurt. The number one thing is to learn about psychosis. Also, know about the triggers and the warning signs. Pay attention to what triggers psychotic episodes. Could it be distress? Is there anything in that environment, if it's at home, that causes stress that can trigger the form of psychosis? Is it lack of sleep? Is it drug use? Recognize those early warning signs when you see them kicking in. Was it showed is your loved one or friend, close friend, having forms of increased paranoia? Are they withdrawing from others? Is there a pattern where this happens, where they're withdrawing from others? Changes in mood that could give signs that are psychotic episodes coming on, when there's a change in mood. Recognize those signs, those triggers, those patterns. Therefore, you can head that off. This can help in early intervention before it's too late. Managing those symptoms can help before they escalate. So that's number one. That's what I always say. If you are caring for someone, even if you've been caring for a long while, it doesn't hurt to learn about the condition now. It's always about education first. So that's number one. Number two is remain calm and patient. This is not easy, to be honest. I think with the role of mental health care, you're always not sure what's going to be around that corner. And there'll be situations where you're going to be shocked. You're just not sure what to expect, and something happens and it makes you anxious. So the second most important thing is to remain calm and patient. But how can one do this? So staying calm during episodes. When someone is experiencing a psychotic episode, it's obvious their reality may be distorted. So helping to stay calm and avoid arguing with the delusions or hallucinations, the things I've mentioned before, and maintain, if you can maintain a reassuring, gentle tone. This is because they may be frightened or confused, but your calmness can help ease their distress. And this is another lecture, to be honest. So we'll do a whole lecture, maybe several of them, regarding what things you might want to say. Because there will be situations they're going to respond to you as almost if it's scolding. They'll say something and it might trigger you, and you might lose your patience. Now, in the past, I'm sure many of you have done, I've done as well. There's no shame in admitting it. But if you can remain calm and patient, and it's not going to be easy to do this, it takes time, it takes a lot of practice, and I'm sure there's different NHS trusts in their recovery colleges or care centers that provide that type of training. In fact, what we call this is de-escalation. They use these types of specific training in inpatient mental health units for professionals who have loved ones well, not loved ones, but patients sectioned on the wards. But for your loved ones, it doesn't hurt to be trained in this sort of thing. Be aware that it can be useful if you remain calm and patient. Recovery, being patient with recovery from psychosis can take time, sometimes a very, very long time. Be aware of this. You're in for the long run. The progress might be slow, not always. I'm not trying to be dismissive. It may be slow, but if you can be patient with that process, avoid pressuring or frustrations if things don't improve immediately. Being patient, again, is one of the second most important thing when caring for someone with a form of psychosis. So recovery takes time, but during an episode, remain calm and patient. Don't let things escalate. So let's look into a third one. Encourage professional help. Now, this is one of the most important roles that unpaid carers or mental health carers can do when caring for someone with a mental health condition. And the reason I say mental health condition, it doesn't have to be psychosis. This applies to all forms of mental health conditions. It could be bipolar, self-harm, major depression, eating disorders. And the reason I say this is you cannot be there 24/7 trying to care for someone. It helps if you can encourage independence. I'm not saying you're not going to be there, you don't want to be there, but there's only so much you can do. And there's reasons why we have mental health professionals. So involve mental health professionals. They're there for a reason. Psychosis requires professional care. It requires professional advice. Usually, this will involve psychiatrists, psychologists, mental health teams, GPs, and take note, doctors that have some form of mental health training. Not all GPs are alike. If you can encourage your loved one that is living with the condition of psychosis to seek and follow professional advice, it will help them to continue to attend those appointments and follow up treatment patterns. Now, the most important thing regarding this is there will be situations where you cannot be involved. It could be a deterioration with your relationship with the person that you're caring for, and that can cascade down to how you are involved in their care. But a backstop to this thing is if you can give them the tools for them to become more independent, there's a chance that they may involve themselves in their treatment plans. And in time, perhaps the relationship might improve and you can continue to help them with encouraging professional help. Medication adherence, although I'm on the fence with medication because there is issues with them, especially side effects. Medication such as antipsychotics can be essential in managing psychosis. So help ensure that they take that medication, especially if it's oral medication. It's going to be very difficult, not only for them but for yourself. It's a tough one. I do admit it. Sometimes it can't always be possible. You can only do so much as you can. But with communication, if you discuss side effects with them, that might be the reason why they decide to miss a dosage. This can be discussed with concerns with the doctor. So that's number 3. Encourage professional help. Encourage independence for them to recognize they have that condition and to seek professional help. And you won't be doing this by yourself. The professionals, good mental professionals, will know this and will also encourage them to stay on the treatment plan and seek help. So we're looking at number 4, and this is communicate effectively. Very, very difficult, this one. Takes a long time. It takes a lot of training as well. Remember, when you're new to this role, you're not going to know. You can't. It's one of the most tricky and challenging illnesses or conditions that someone can live with. So listening without judgment, very difficult, but it's important. When communicating or listening empathetically and trying to avoid being dismissive of those experiences, even if they seem irrational, which they are, you want to validate their feelings without reinforcing those delusions or hallucinations. I admit this is very difficult to do, but if you can listen without judgment, listen without stigma, it's a way to avoid escalation of psychosis, and it's a way to stop, reducing them, pushing you away. Obviously, you'll have to communicate, especially if it reaches that crisis point. But they are going through forms of thinking that is delusional, and they are going through the delusion is real to them. So be aware of that. The other thing in regards to this, if this is proving difficult, try and use clear, simple language. So during periods of psychosis, the person may struggle with processing complex information. They just can't. So you're not going to try and start reading a book to them. What you will do is speak in short, simple sentences, repeat things in a calm manner, rephrase what you feel might be important to them as needed to ensure that they understand. So communication is one of the keys in helping someone living with psychosis, communicating effectively without judgment and simple language. And again, you will get it wrong. Even with my experience, I'm sure that if I try to support someone with psychosis, I will get things wrong. It takes a while. One thing to note before I move on to the next thing is, obviously, when you get it wrong, do not be harsh on yourself. Do not judge yourself. It's a condition that is tricky to deal with. So let's move on to number 5. Creating a supportive environment. The environment really makes what the person is and how they recover. So if you can maintain a calm, safe space, this will ensure that the environment is calm and structured. It reduces noise. Not always, it depends where you live. But if you can reduce noise, reduce the chaos or stressful situations, that can minimize triggers and promote a sense of safety in where they live, whether they're with yourself or live on their own. You visit them, you could help or suggest to them how to create a safe space. Set routines. You can mention to them, like if you can establish a daily routine, including, and this is what you're telling them, regular sleep, meals, activities. This can provide structure for them to reduce the stress, reduce the triggers, helps your loved one stay grounded in reality. Not always easy, but it's definitely one of the main things that can help them. And this goes the same for yourself. You might, or you should, not might, try and get regular sleep yourself. Eat healthily, exercise, look after yourself as well. So that's number five. Let's look at number six. Respecting their reality, but also setting boundaries. And as you can see a picture of there, where the boundaries have just fallen apart, and you're trying to discuss with someone who's unwell mentally, perhaps physically, and it's just not working out. So it's time to set those boundaries. What do I mean by boundaries? You can only do so much. So avoid arguing those delusions or hallucinations as what the picture is showing. While it's important not to reinforce those delusions or hallucinations, arguing or trying to correct the person's perception may start to make them feel defensive and distressed, and they will not want you involved. They will not trust you. So acknowledge that they are experiencing what feels real to them, but gently bring them back to a shared reality when appropriate. Again, this is another lecture for another day in a sense. I'll provide some examples on how you can try and do this. I'm not saying it's going to work 100%, but it's something you will need to consider when a psychotic episode appears. The boundaries, though, it's important to set boundaries. You're not a punching bag. If the person's behavior, your loved one's behavior becomes aggressive or disruptive, let them know that certain behaviors are not, I repeat, not acceptable, and that you care about their well-being. But you do need to protect your own safety and emotional health as well. You are not a punching bag. There is a high risk for mental health carers to be there on the line, taking blow after blow after blow. That is the nature of providing unpaid care. You put others first and yourself last because you're trying to provide the care. And it's not just for the person living with the mental health condition. This can be the services they will put upon you. The reason why they will put upon you is because they lack resources themselves. So because of that, they want the carers to step in and do more, even when they don't want the carers that involved as much as well. So it's a bit of a catch-22. Again, another lecture for another day, that one. But it's so important you set those boundaries, because if you don't, you risk your own mental well-being. That means you might lack a safe space for yourself. You won't get much sleep, and you will develop mental health conditions. You're at risk of them. So that's number six. Number seven, we're moving on. Promoting self-care and wellness. And that's not just for your loved one living with the condition of psychosis. That is also for yourself. So encourage healthy habits. Another reason for this is the medication. If they're on medication, I'm sure they will be on antipsychotics. But you've got the side effects of weight gain and other things as well. Not just the medication, but with psychosis, there may be situations, especially with schizophrenia, where they don't want to do anything. That is part of the condition. They're just tired. So if you encourage healthy habits, it helps the person maintain good physical health, including regular sleep, balanced diet, exercise, and avoiding those things that can trigger or make the condition worse. So avoiding drugs or alcohol. These factors can have a significant impact on their mental health. Do remember, I've got to include this, make sure it's in their care plan, and that the mental health professionals draft these. Could be coming from the care coordinator or social worker, or even the ward pharmacist. So encourage healthy habits, not just for them, but for yourself as well. Support and engagement in activities. So encourage your loved one who's living with the condition of psychosis to participate in activities that promote a sense of purpose and connection to reality, such as hobbies and healthy hobbies, social interactions, or even volunteering. Now, this is not going to be something that's going to be done right away. Obviously, it takes time to do. And do remember, social prescribers, psychiatrists, mental professionals can also promote a sense of connection to groups. Now, remember, we've got those out in the community from Rethink centers or centers that's coming from Mind. Do look around because that's their remit to engage with those living with mental conditions, to connect and increase social interactions, hobbies. Art is a brilliant hobby. Calm takes time for them to do, engages, and makes us happy, make them happy. They don't have to do art. There's other forms. So keep them busy. Keeping your loved one busy can reduce the intensity of psychotic symptoms over time. So I think there are 3 more to go. So build a support network. This is for you, actually, not for the person with the condition. You need to try and involve families and friends. So caring for someone with psychosis can be overwhelming. There's no doubt about that. So if you have family members that are interested, I suppose, or even close friends or support networks, to share the caregiving, and I shouldn't say burden, that's not quite right, caregiving role, and ensure that the person has a strong support system as well. This is also for yourself. And for you, and I do run many care support groups or engagement groups, for you, seek carer engagement groups. There's a lot of care. I say that, not quite happy. I mean, I say this to carers I come across to, and I say to them, what help do you want? And they say, oh, don't want anything. I only want what helps my loved one. And I say, yeah, fine. But in the back of my mind, I'm thinking in long term, that's not the best thing to do. Maybe at that point in time, it's not right for the carer, but I always say, listen, a bigger network or a network that's fairly close, always helps out. It really does. So if you can join a support group at your local care center, especially for those caring for someone with psychosis or mental condition, those ones are really good. Talking to others in similar conditions or situations can provide that emotional support, practical advice, and a sense of community. Now, there's a reason why many people say that carers are hidden. It's one of the worst things, and I repeat, one of the worst things that can happen if you're caring for someone. Now, sometimes it can't always be helped, but when it can, it's so important to get that support network for yourself so you're not isolated, you're not hidden, because without a doubt, it will worsen. You'll be in a situation where your loved one may have a psychotic episode and you can't reach out to anyone in an emergency list, or in a contact list on a support group. You're not getting that advice, you're not getting that peer support. So it's really important you build that support network, not just for your loved one, but for yourself. Don't forget the support for yourself. So number 9, and I did mention a plan, but this is a crisis plan, not often provided, oddly enough, by the mental professional, but they can help in this. But don't wait for them to do that. You can ask for a bit of advice. You should really try and develop a crisis plan in place. This is on the lower end of the scale. I expect you won't really know what a crisis plan is. Let's have a look. It's basically preparing for emergencies. Obviously, don't wait till the situation comes at hand. Psychotic episodes can sometimes lead to crisis. You really can. So work with a mental health team to develop a crisis plan that includes what to do during an episode. On that crisis plan with contact information for mental health services and emergency numbers. Now, I'm not saying they're 100% crisis plan. The way services are, it's difficult to get in touch with hardly anyone. But does it hurt? Ask yourself this question. Does it hurt to not have one in place? And obviously knowing when to seek help. If the person becomes a danger to themselves or others, do seek immediate help by contacting their mental health team, calling a crisis line, or helping them to hospital. Now that is what's difficult when they've been to the hospital. But you've got to try. That's the sum of all things what I'm trying to say here. You've got to try. Obviously, when the situation does become really dangerous, then don't do it alone. I wouldn't advise that. But having a crisis plan in place is important if you're a mental health carer. Last one, and not, I think it's probably the most important one, really, is do take care of yourself. It can only help so far. The tragedy with mental illness is it's disrupting one person's life, but if it disrupts the carer's life as well, that is a double tragedy. It's important to take care of yourself. Prioritize your own well-being. Caring for someone with psychosis can be stressful and emotionally draining, no doubt about that. So it's really crucial to take breaks, practice self-care, and maintain your own physical and mental health. Really do that. If you're feeling overwhelmed, seek support from friends, family, or even a therapist. So the bonus, I suppose, and the reason I say it's bonus because there's a lack of them. Respite care, if needed, and I'm sure it is, to be honest, consider using respite care services to give yourself the time to rest and recharge. It is important to avoid burnout, so you can obviously continue to provide care effectively. I'll put this sort of last because it's really difficult to get hold of, but again, you've got to try. So summing this all up is, these tips focus on fostering a compassionate, structured, and supportive environment while ensuring that professional help and self-care are prioritized. Balancing care for the person with psychosis and taking care of your own well-being is essential for long-term effectiveness in caregiving. So I'd like to say thanks for coming along and trying to educate yourself. I mean, there's a lot more to this. There's a whole lot more to this and caring for someone with psychosis, but I'm trying to make it brief. I'll do another lecture in time regarding this condition and many others. I'm not an expert. I'm just coming from this from a lived experience point. I've lived in trying to care for someone. Some of the stuff I've Googled, the most common themes and what I've heard from other carers as well. And as a reminder, there will be many more things I'll be trying to promote off my channel and from my blogs. So do remember, make sure to hit that subscribe button again if you've not already done so. So you never miss helpful content. And I'd like to hear from others who's watched this video, what tips they do actually in helping to care for someone with psychosis. So again, I'd like to say thanks for watching and remember to take care of yourself. We don't want mental illness to strike everyone out there. And it's one of the most important thing I say to anyone out there, take care of yourself. See you again next time.